According to Chicago Med, in the 1960s, there were 3 to 4 million cases of measles reported each year, 4 to 500 which resulted in someone dying. And in 2023, there were only 58 cases of the measles reported and no deaths. Now, what's the big difference between 1960 and 2023? The measles vaccine was created in 1963. Parents should vaccinate their children, and there are many reasons for this. Vaccines help prevent many dangerous diseases such as polio, whooping cough, chickenpox, smallpox, measles, and so many others. Some of you might be wondering why some parents would refuse vaccines in the first place if they prevent such awful diseases. And there are different reasons, but the main one is fear to misinformation. Andrew Wakefield published an article in 1990 that stated that the MMR vaccine, was linked to causing autism. However, this was debunked. Many kids are already showing signs of autism by 12 to 18 months, and that's when the first MMR vaccine is administered, so his theory was completely disproven as false. I'm a pediatric medical assistant, which means I'm the scary shot lady to your children, but more importantly, I'm the one vaccinating your kids. And so I've seen a lot of parents hesitant about receiving vaccines or doing multiple vaccines at once. They don't want to harm their child. Well, yes, it is painful, it's a little uncomfortable, and there are some side effects. They're perfectly safe, and they're a lot more comfortable than getting chickenpox or getting polio that could have long-term side effects. And there are also combination vaccines that have been created to lessen the number of pokes needed. So, for example, the clinic I work at has a vaccine called Vaxillis, and it includes DTaP, Hib, Hep B, and polio, and it's given at 2, 4, and 6 months. So this takes 4 vaccines, 4 potential pokes, and turns that into 1 shot, and completely has the full dose and is completely safe for children to receive. And however, I've seen some parents that have the opposite fear. They don't want to overwhelm their child. And in those cases, they can talk to their pediatrician about an alternate vaccine schedule. They can split up the vaccines, and it still would be vaccinating them for each and every one of the diseases. Another reason is that some parents haven't seen the diseases. They've been eradicated, so why is it still important to vaccinate for a disease that's no longer around? And one of the pediatricians that I work with, she said it in a way that I think is super accurate. She said, vaccines are a victim of their own success. And basically that means that the diseases aren't around because the vaccines are working. They've been eradicated because large numbers of the population are being vaccinated. And this is also important because there are some people that can't receive vaccines. The clinic that I work at, there are kids that have transplants, so they're unable to receive live vaccines, which can cause infections, which would be harder for them to fight off because they're immunocompromised. Vaccines are given at a young age, and it's super important that parents follow that vaccine schedule and start at a young age before the children are exposed to diseases, because infants, along with the elderly and immunocompromised, are more susceptible to harder recovery and death or long-term effects from the diseases. While fear is cited as one of the main reasons that parents choose not to vaccinate their children, I think they aren't scared enough, and certainly not of the right thing. Reservations and questions, perfectly normal and healthy. I'm a mom. I've been a pediatric medical assistant, and I still ask questions when I'm unsure. And I think that making sure that parents are receiving their vaccine information from reliable sources is vital, as well as them understanding what we're preventing against. So here are a few different diseases that children get vaccines for in their childhood. So measles. Measles causes high fevers, cough, runny nose, and a rash all over their body. Complications can range from pneumonia or encephalitis, which is swelling of the brain. Polio causes weakness in the muscles. It can be treated but not cured. It causes paralysis that can sometimes be fatal. And Hib. According to the CDC, you can protect your children from Hib by getting vaccinated before the child is 2 years old. And Hib is a serious disease, as said by the CDC, that can lead to a range of different things: meningitis, pneumonia, throat infections, and can cause lifelong disabilities. So when you are encouraging people to vaccinate their children, you're not only protecting their children and looking out for them, but you're looking out for your own child. Herd immunity creates a less chance that your child is going to have the risk of getting that disease. Making sure that larger amounts of the population ensures that your nieces, nephews, immunocompromised loved ones, people battling cancer, cystic fibrosis, that they're less likely to get that disease because other people around them have taken precautions. So here are some things that you can do. You can point them to the right resources. Some great websites, as recommended by pediatricians that I work with, include CHOP, which is the Children's Hospital of Philadelphia, the World Health Organization, and the CDC. Number 2, you can advise them to speak to their pediatrician. Urge them to ask all of their questions, voice their concerns, get properly educated instead of going to mom groups and other people with the same fears. And lastly, vaccinate your own children. Be a success story to motivate them to vaccinate their children.